What we believe is that there are some places where very inspired, passionate patients have set up groups, but often that's not the case. And there are people who would be very willing to do something, to set up a group, but they don't really know where to start. They haven't actually said this to anyone. And the people who can actually interact with them are their healthcare workers, and very particularly clinicians often. For example, hepatologists.
The easiest way is actually trying to get the patients from their clinic, their existing patients. That's what I did 2 years back. We tried to actually get some patients and then made it aware that we were recruiting people to actually form the patient advocacy group. And I think that's the main thing. And to get this going, you have to be very clear, make it very clear to the patients or the participants. It doesn't have to be just patients, it can be the relatives as well, the family members. But be very clear what the objective for this patient group is. And I think the bottom line is really to actually have a change or drive change in patients living with hepatitis. And the other thing that should be mentioned, that not to intimidate them. Make sure that you have to stress that this change does not happen overnight. It will take time, but you have to start somewhere.
We will get our patients and their family together by two ways. One is from the hospital base, because the patients, they have regular visits for their hepatitis. We encourage our patient and their family to join these patient groups. The another way is from the community, because we facilitate the free liver disease screening in our community, especially underprivileged or in the hyperendemic hepatitis area. So we let the people from the community to join the patient groups. That's the two ways we have been doing.
Over a period of time, I have in my clinic identified patients who would be good to convince other people, who would be able to stand up and talk. And I have formed my own group amongst my own patients. And now they are ready to train other people. So I think each doctor, if he or she identifies amongst his own patients, people who can effectively communicate, and whoever will. There are many patients who are very happy searching the net answers for themselves. They are not happy to come out and talk to others. So a doctor would need to identify which patient is the one who would not mind coming out and speaking, because it is finally giving up the identity which would remain undisclosed if he doesn't come out. So I think identifying the right patient, the doctor can do best.
Go a little bit beyond the normal medical interaction and ask them if they want to do something about the viral hepatitis situation in their country, for example. Then gather together a group of people who are interested and ask them together, call them to a meeting and ask them if they would like to set up a patient group. Get someone to explain what that might entail. And this is something that we, for example, did in Russia. So a clinician was giving talks, just information talks to patients.
Patients always ask what we can do to improve access to treatment, how we can help you doctors to improve access to treatment. And this is best opportunity to say that you need to get together and you need to be together to influence the situation, to talk to the Ministry of Health or other authorities to promote your needs. And it helped in Russia to get together patients, organize this United Against Hepatitis patient group.
And then they called me and I went to visit them and I spent a day with them running through a lot of the pitfalls, but also what you can do, what you should think about, what your next steps are. From that, they went and looked at some of the key basics that you need. You need to look at the legal structure.
Our association started with me and a lawyer who was a patient. So I think when there is a sufficient number of interested patients, they should look for a legal advisor and they should start making a legal body and association.
Then there is funding. How do you fund it? Just some initial startup that might pay for an office, or it might be somebody who could provide an office for free. Again, healthcare workers may be able to use their contacts to provide this. You know, for example, if you wanted to go to the pharmaceutical industry for funding, they will know people in the pharmaceutical industry for sure.
I guess the source of funding can be various groups. It's hardly going to be government in the first instance because it depends on countries. Because in countries like Malaysia, it will not be one of the things that the government would like to promote. But what we can actually do is try to approach pharmaceutical companies to help to actually do this as part of their corporate social responsibility or part of their commitment to care and control of patients with hepatitis. And I think we have seen that happening even before the pharmaceutical company even launched their drug. We can actually ask them to actually get this patient support group happening.
So then you set this in train. But one of the key things here is to have a meeting at which people pledge how much time they are prepared to give to this. Because you need to know that there is that core time to do the key things that you need to do. And then you need to sit down and decide what your goals are. What are you trying to do? Ideally, before you even start this, you come up with a short and medium term plan that everyone then buys into, so that you know you're all on the same page to start with, and that prevents a lot of arguments falling out later on. So essentially what we're saying is get the patients together, hold probably a series 1, 2, 3 meetings to talk through all this. The legal process, the people who really want to be involved, how much time, what the aims are, where they might go for funds, what you would do first. That's a key part of setting up short-term and intermediate goals.
With the infrastructure in place, with the right committee, I think it can grow. First of all, you want to grow the numbers and vote in the committee. So I think initially you need an interim committee, and then eventually, once you have enough members, they'll get voted in and formalize the process.
You really have to get a motivated group. You have to have people who are enthusiastic to do this. And one of the things to get this going is actually have, it may not be face-to-face discussions all the time. It can be virtual through even email, and then have like a dedicated website. And this website can function two roles really, to actually let others know that there are such a group, and then also the fact that you can actually promote the patients to tell their stories.
So, for example, in the UK, when I set up the Hepatitis C Trust, because we were set up initially as an information and support service, the first thing we did was decide to build a really good website. All the information that we'd wanted to know and couldn't find. The second thing we did was to provide the support, so we set up a telephone helpline. Then we got involved in the advocacy, so it happened bit by bit. We actually did this rather as we went along. It's better if you plan it. It's also easier to get funding if you know what you're trying to do.